I would like to welcome you all to part 2 of Mass Health Services and the Changes. And we'll be hearing today from Leo Sarkissian, the Executive Director of the ARC of Massachusetts. So Leo, I am going to hand the ball over to you so you can control the slides and take it from here.
Awesome. Thank you, Kerry. Really appreciate being with all of you. Welcome. And we're going to get started. And the first thing I'm going to do is just spend less than, not too long about telling you about the ARC itself. And hold on a second. Oh, that's weird. I know how to do this, Kerry, but I'm trying to move the screen and it's not listening to me.
Are you trying to change the slide?
Yeah, right up here.
Okay.
Yep, I got it.
Just up,
all right,
up. Okay. All right.
Too many times, I guess.
Okay.
Anyway,
okay.
sorry about that, everybody.
There you go.
Like a greenhorn every time with the slide. This is a picture circa probably the 80s, and it was during a tough time in the budget. But the ARC has been here since the 50s. We're part of a national movement. It's both a civil rights movement and, of course, over time, agencies that are more local or regional also became service providers. But so we work at the state and national levels. We're an umbrella for civil rights advocacy for our entire constituency. And basically, affiliates that join make a commitment for that long term to support that effort and be partners in that. And then we're fortunate to have other organizations, too, that join that aren't either ready to be affiliates, not sure they can be affiliates, and they help our efforts as well. But we're about the families we represent, and that's why, we do some of these free webinars so that we can keep you engaged, both staff that can then train families as well as families across our service system. It's really important for people to get the word. From our history from the 50s, I can just say starting from advocating for schools and transportation to being one of the class members of consent decrees. And that was really in 1974 when community-based system got built into a lawsuit, and the ARC made sure that happened. And in those days, probably the state agency we were part of, all in, because we were part of the departmental health services, they probably were under $100 million. And today, DDS alone, Department of Developmental Services, is a $1.6 billion agency, just to give you an idea of the advocacy and involvement and the changes over time. So we're doing that. Mass Health and, honestly, DDS in our state are probably the two most important funding vehicles. Obviously, there's Mass Rehab Commission, there's the Mass Commission for the Blind, there's other important organizations, but those are probably the majority where the support is, except in the case of MRC where you have employment services. What we're talking about today is what's called Masshealth Innovations, and it's basically Medicaid and managed care. And Medicaid is the national term for the insurance that's a public sector insurance, really, for health care and long-term supports. Medicaid is the only insurance that provides you long-term care, because if you get private insurance, it's much shorter. But Medicaid, of course, is an alternative health insurance for people that can't afford to be in regular health insurance services. And so to save dollars while continuing a substantial Medicaid program, Mass Health has developed what's called accountable care organizations. And we covered some of this in the first one, so we're going to go through this quickly. You can always download, look at the first session it's still posted to learn about this basic stuff. And I'm not going to give you the blow-by-blow definitions, but basically because of developing this option, they feel like if they make medical practices and medical systems responsible for the cost of care, and they'll get rewarded or penalized based on how they do things, that there'll be lower numbers of unnecessary emergency room visits, there'll be less unnecessary hospitalizations, that they'll do a better job being proactive and providing care in a preventive form, as well as responding if someone has diabetes to make sure they're on the right program. Bring them in for a second appointment. Don't let it wait till they have to go to a hospital. So that's the strategy in terms of saving money, and obviously everyone wins if they do the strategy that way. There are two types of ACOs, I don't think it's more from a management perspective. In one case, the ACO has all its services within its network. So, for example, if you're a partner's ACO, accountable care organization, you're not going to have your doctors, but you're going to use your hospitals, which would be like Brigham and Women and Mass General, so on and so forth. And that's true of any other ACO partnership plan, which most of them, by the way, the new ACOs are partnership plans. The second type is called primary care accountable care organization, where a physicians group contracts with Masshealth, and they want to use the network Masshealth or an MCO managed care organization already has. And that's what you need to know. That's probably the most important thing to know, that in the primary care one, if you suddenly find yourself in that, it's probably the same hospitals that you had access to before, okay? And then there's managed care organizations will continue, and then there's the existing primary care clinician program. So they'll do less coordination, but Masshealth wants you to move away from this, but that is still an option. Eligibility to be in this new initiative. So when you see the book, that big guide, you're going to see 4 new insurance programs, or 4 insurance programs that are not new, effective March 1st. And 2 of them are those ACO programs I just mentioned. The third is if you go through managed care, so if you're in TUPS managed care, or you go through primary clinician, those will continue. But to be in the ACO programs, those first 2 I mentioned, you have to meet these criteria. Under age 65, without other insurance, including Medicare, you can't have Medicare, living in the community, not in a nursing facility, and you have to have one of these 5 Masshealth insurance programs. See, Masshealth Care Plus, Masshealth, Common Health, Masshealth Family Assistance, or Masshealth Standard. So, and the goal is to provide integrated care, as I think I mentioned earlier. I'm not going to repeat that. Now, here's a key tidbit, key tip. If your primary care doctor is moving to an ACO, you will be automatically assigned to that ACO unless you choose to opt out of that assignment. Okay, you would have to then either by web or by phone say, you know what, no, I don't want that assignment. And they'll, basically the guide's really important. If that doesn't tell you how to do the guide, actually there's a site, which I'll explain later, where you would go to handle it. And then we're going to have other tips for you in terms of getting help. So the guide's going to be mentioned again, but we just tell you where it is now as well. But it's a big guide. It's about 50 pages because it also includes how Masshealth identifies regions. So if you're in a very small town, it'll tell you what region you're identified with. Community partners, I'll just spend a second on this. That will roll out in June. They will help people who have behavioral health conditions, so mental health or substance abuse issues, or those in need of long-term supports, such as people with disabilities who need personal care attendant services or adult family care, et cetera. There are 9 community partners for long-term supports and services, and there are 18 across the state for behavioral health. And you can't just go to them. They will be referred by an accountable care organization. If someone feels like they need additional help, that's like a case manager to think through everything about the person more holistically, what long-term supports they need. That accountable care organization will refer the person to the community partner. So as you move forward and trying to figure out what you're going to need, okay, if you're even affected by this, first place, a lot of you that are affected by this would have already received a letter from Masshealth, and I'll tell you about that as we go along. But when you go for help, whether you do it at a Masshealth event, which I'll tell you about, or you do it by phoning a navigator, or in person, or on the phone, however you do it, it's very important to have number 1, okay? All the medical practitioners you have. A parent, an activist that I know who's very involved in the field, she said to me she's caught, and she's the second person, by the way, that's told me this, she's caught between a rock and a hard place because her primary care doctor is going one place, and they use the Lurie Center, which is connected to MGH, and that's only available through either the primary care clinician program or going with, I assume, partners. I'm just making that up. I would have to look in the book. But the point is they're not at the same place. And so they're either going to have to choose between specialists or their primary care doctor, which we call a PCP, primary care practitioner. Whenever you see PCP, that's who we're talking about, he or she. And it could be even a nurse practitioner, right, in some cases. But you should have your list of all of those, because that's, there may be a tough decision to make in terms of a trade-off. And then finally, they suggest Masshealth that you have your identification with you. It's not essential, but I'm sure that's appealing to people who may be in tough circumstances, or partially homeless, or can't communicate, and are going alone. And then your letter from Masshealth if you received it, or if it's available. Got a typo there, sorry. So what are the letters from Masshealth? It's like there's a movie, 3 letters from so-and-so. I always think of that when there's 5 letters, 5-letter types. And again, if your loved one's on Medicare and Medicaid, they're not getting this letter. They had a chance to be in OneCare. Obviously, we're concerned about OneCare, so a lot of people didn't join OneCare, but they can't, they're not going to be in this. But if you have Masshealth and those programs were identified and meet the other criteria, you're going to get one of these letters, or your loved one's going to get one of these letters. And basically, all the letters have a green stripe on the envelope, so look for the green stripe. And many of them, by the way, went out in the fall, late fall. So, because basically between March 1st and May 31st is the decision period. So, and whatever, by the way, March 1st you're going to be in a program. You can still change it, but they're going to assign you. But green stripe on the envelope and Masshealth A in the letter header. I was writing letterhead, but it's letter header. You're moving to an ACO partnership plan. And those are the ones, again, like they have the whole network. And if we have time, I'll show you a page out of the guide, a couple of pages, because it's really not that difficult. It just, you do have to get used to the guide, but it really is basically telling you about all the darn plans, the territories they cover, what they offer. That's what it does. It's actually not bad. It's pretty good is what I would say. I shouldn't say not bad. It's actually, they did a nice job. The second one is if it's Masshealth B in the letter header, means you're, going to a primary care ACO. And I'm sure it's, I haven't seen a letter. I should have asked for a letter before I did this, but I'd love to see what it says. But I'm sure it would give you contact information that I'm going to give you and related stuff to change the assignment if you want to. So in any of these cases, you can opt out, okay? But you're going to have limited choice to opt out. So if you're, and the reason, by the way, 1 or 2 happened is the primary care doctor, practitioner, moved and is now in an ACO partnership plan, or is now in a primary care ACO. They can't be in that and still be in the primary care clinician program, okay? So that's it. The primary, that person's out of the loop on that program, that primary care doctor, and you need to know that. And that's a drag, and that I realize too it can be a hardship to find a new primary care doctor. Then the green stripe on the envelope at Masshealth C means that the person's going to an MCO, managed care organization managed plan. Now, what's really important to understand about that one, I'm assuming some people are already in an MCO, and we're trying to get to the bottom of, would someone still be transferred if they're already in like the Tufts Health MCO, for example. But again, you could opt, I would think it's the same medical group in either one, you would opt to either stay in that or just go with that. But the bottom line, again, is the doctor is in the MCO-administered ACO. So that's, again, the same reason that the person's being told they're in that, automatically enrolled in that program. So that leaves the last 2, which is if you have Masshealth AE in the letter header, the primary care practitioner didn't move, but they've changed the current plan. You've still got to go into that guide, look at the 4 plans. And if you had a primary care clinician program, if you were part of that, obviously you may want to, just for safety's sake, just choose that. If you have the time to really evaluate and you really want to have the integrated care option and you feel there's an advantage to that, and you probably do have the time, I'll tell you, you could sign up for the PCC plan, Primary Care Clinician Program. That one you can change any time you want during the year. That's the only plan, if you're in, that you can actually move out of any month you want, because they're trying to get people out of that plan. So you could do that for safety purposes, assuming your primary care practitioner is still in that, available to that plan, and that buys you time to interview different accountable care organizations. And finally, the green stripe in the envelope and Masshealth PSP in the letter header means the person isn't moving at all, unless you choose to move. You're just where you are. You know, and a great example, that would be if a doctor didn't join any of these. The doctor stayed, or a nurse practitioner, whoever it is, stayed in the primary care clinician program. And, you know, everything almost stays the same, I would think, but you would want to double check that as well, right? Call your specialist, call people, and make sure everything's copacetic. So those are the 5 letters. I assume, I don't know if people want to raise their hand, see how many people received letters. Can you raise your hand if you received a letter or you work with someone who received a letter? I'm waking people up here. Nobody. I don't see any hands. Oh, there you go. Two hands there. 4. Oh, yeah. Oh, yeah. Okay. So actually, person raised it for themselves, as well as a number of people have gotten them. Okay. So this gives you sort of, I think as a provider you might already know this, but just reinforcing, you know, what's going on with those letters. And then here are your choices, right? And if you are auto-assigned, you can choose one of the other options noted in the guide. So there are 4 insurance programs. I mean, Masshealth is really an insurance program, right? And there are 4 of them. And, you know, the 4 I already outlined, the 4 that are in the guide. So if your health plan is not one of the ones in the guide, you need to choose one of the 4 options in slide 4. And so the bottom line is you might be, I don't know what it would be, you know, what the program was that is gone, because honestly, I feel like there could have been probably a specific program that probably merged into the MCO or the ACO, but you will have already been redirected if that's the case. You'll have from March 1st through May 31st. I mean, that's a nice amount of time. And then you're in the plan after that, if you don't make a change, till the next March 1st. And there are exceptions. If you go to page 32 of the guide, you can check that out, what the exceptions are, and they make sense. And those in the primary care clinician plan can change at any time. One thing we are going to look into, though, is this whole double bind situation people are facing, which we warned them about with special populations. So we're going to follow up at Masshealth on that both today, and then I have a meeting in person this week, actually on Wednesday or Thursday, where we'll follow up with that. So here's how you can learn more, too, about the program. It's so important, you know, to take advantage of that, these opportunities. And before I get into a few more detailed depth on a few more things, February 3rd, you know, these are the dates. Basically, Masshealth itself has identified navigators that are well-trained who will be available in different parts of the state on different dates to coach people in person, okay? And, I mean, this is the kind of thing that you may want to show up. Maybe would hope they'll have numbers that people can draw. As you can see, one of them is at the DCU Center. It's a pretty darn big facility. I have no idea how many rooms they have, but that's February 7th. I'm sorry, February 3rd, and the snow date. So that's this coming up either this week, it is this week, or snow date follows after that. There's then one in Boston at the State Transportation Building. And, you know, these are for like several hours. So it's well worth people taking advantage of it. And we're posting these on our website. I'm going to mention in notes from the ARC. There's one in Chicopee on March 20th. I guess they figure once you get deep into March, you don't have to worry about a snow date. Hopefully they're right. March 27th, they're at the Crown Plaza Hotel in Pittsfield. Fitchburg on May 8th. May 12th at Somerville Holiday Inn, and Brockton Library May 15th. That'll be cutting it close for decision time, but that's great, you know, all these options. The other thing, I guess it's really important, and we will have time to go through the guide, so I'm happy about that. So basically, I'm gonna. I don't know if you can see my desktop. Carrie, can people see my desktop? If I or can we arrange that?
You have to share. If you go up to the very top and say share,
great.
Okay, and then say share your desktop.
Yeah, so what I'm going to do is finish the slides, right? And then I'm going to walk you to look at my desktop, including the guide, okay? Because I think that would be helpful for people. And then if you want to, get your questions ready or whatever at that point. But basically, these local navigators. So, for example, I actually put in the Boston Public Health Commission because they have like 7 languages they're proficient in, which includes English, so maybe 6 about English. I mentioned that specifically because maybe other city offices like Worcester have those kinds of assets, right, a navigator. But if we'll take you to the site a little later to show you. It's related to the connector, but they're navigators at usually hospital financial offices, patient counselor offices, and then community health centers. Almost all of them have a navigator, okay? And I'd say in a few months there'll be an ombudsman program. So that's something. And we may add a couple of things to this slide, by the way, for getting more help, because I did get some feedback from another colleague that I didn't have a chance to look at. And then again, we mentioned how we posted the brochure, and don't get disappointed when it asks you for your email and stuff. People do that all the time now. It's good digital media practice. We're trying to find out who's following us and who's involved, and so we can communicate with people. You can always unsubscribe, but that guide's there. And today we're posting 2 other flyers, which I will show you really quickly. One is a flyer for the Masshealth events, and then the second is the explanation of this process on 2 pages, I think intended for people who work in healthcare settings and other providers, but you'll see them. I'm hoping to have a chance to show you both during this presentation. And again, this is just recapping again what Masshealth covers, right? It covers a whole range of services and supports, and healthcare, emergency care, drugs or RX, rehabilitative care, dental care, whole range of things. So it's just good for you to know that. And then to review and choose plans, it's important to know, that masshealthchoices.com is there. So if we're going to go to that one too to show you how that works, where you're going to be able to review and choose plans. Just want you to know that. And then there's a customer service center. I know I've heard feedback from some families that, that's a tough place to call. I think I've heard from others that they've gotten some answers solved. I know they've been working on that. They've been working on these customer service centers, so hopefully they'll be more responsive. But that's why we're also encouraging navigators, and that's why Masshealth is doing these live events. They can have the right people where you need them, because Masshealth is a huge program, not just for people with disabilities. And then I think I'm about to take you now. You can start sending your questions, but I'm going to take you to these sites. Let me share my desktop, okay? All right, now I'm sharing the desktop, right? Okay, what happened? That's interesting. Oh, that's right, I got to bring up mine. That's why. Okay, that's okay. I got it. So, all right, so we're going to go down, and we're going to hit, okay, oops, sorry. Actually, that was stupid of us. Stupid of me. Let me just quickly get down there. I'm going to take you to Masshealth Choices first, because I think that's the one where you get to choose the plan and stuff. I don't know if any of you have been on it or not on it. We're going there as we speak. So basically, it can seem daunting. I think if people have disabilities, intellectual disability, they're going to need help. someone with autism has executive functioning issue, they're going to need help to access this. And I think all of us would have questions regardless of disability or not. You know, I would have questions, right? These are the general explanations. And then choosing the health plan, choosing a primary care provider. I mean, this is what you're going to have to do if we can't figure out another solution to the specialist being split from your PCP. You may have to end up choosing a primary, care provider, and then you basically, this allows you to change the PCP at any one time, and they give you a phone number where you can do that with. And then enrolling in the health plan, that's obviously enroll online, start you with your computer. So basically, you can see I did this before, but actually it's a riot because it's not ready yet because it's March 1st, so I can't really walk you through it as I wanted to. But you get the idea. They will have it live on March 1st. Let me go back to this. And, sorry. Let me go back to the desktop. Okay. I'm going to go back up and before I pull open the guide, I'm going to take you here. This was the one I did scroll through a bit. Okay, I'm going to close this one. Okay. All right. Okay. So they call it an enrollment assister. That's the same thing as a navigator. All right, so we're going to actually go here. And I'll be honest with you, if I didn't know what I was looking for, I would not have picked enrollment assister. So that is an issue. Okay, I'm not going to allow location access. So basically, this will pull up, and I'm going to put in, okay, so see, here you go. So what you can do, though, is you can actually select a location, or you can select a category. Okay, navigators is 28. I mean, I think that's a good category, right? Let's see if ABCD. So that's a certified application counselor. So there, Boston Public Health Commission comes up right away. Here's a navigator in Springfield. So you have them, and obviously Cambridge, no surprise there. Here's one at Squantum Navigator. That's what the community mental health centers seem to. There's 3. I don't know why they're popping up 3 times. 3 locations, that's why. They're actually in Taunton also. So this is great. I mean, so it's saying they're showing 21 of 28 results, but I'm only seeing a handful. So I will send them an email about that. But maybe I didn't pull down far enough. That's really weird, huh? Anyway, I'm sorry. You probably have to pull down on this. So that just gives you an idea. And these all across the state, really great idea to use these if you're having issues. Okay, and then the other thing I want to do, wrong one again, sorry. I want to take you to the guide. And we're in the middle of putting up a third link, which will have the flyer for Masshealth on the events, as I shared with you. And I'm going to close this one. Okay. So there'll be a third link here. It'll say Masshealth now. Okay, so I got to fill this. Oh, actually, I don't have to fill this out. You know why? I have it in my thingamajiggy. So here it is. Our files. That's our file system, folks. We've got 10 million files. So this is the guide I was telling you about. It's really helpful. People can learn about, here's the eligibility stuff, right? And they even tell you who can't use it on that one. I just told you who can. And then you basically get the run-through, right, of what the different plans are. And see how it says you can have a community partner and explains what a community partner is. And then plan selection period, fixed enrollment period. That fixed enrollment period, as I shared with you, is between, May 1st and the next March 1st. Then, again, these are the 4 managed care organizations. And, it's interesting. I don't mention the community partner here, but I know they're part of it. Let me go back. This kind of plan is delivered by the ACO. Okay, may get the services of behavioral health or long-term services partner. Okay, so there you go. Okay, it is telling you may get that. And in the managed care organization, you also may get the services of the community partner. Okay, but in the PCC, because they're discouraging you, hold it. Maybe you are getting it. I thought I was told you wouldn't be. No, you wouldn't be. Okay. Yeah. All right. See, please know community partners are not generally available in the PCC plan. May not be as coordinated. The fact that it's saying it's not generally available means you and I know we could probably help you connect with a long-term support center. So, but again, I appreciate that Masshealth is trying to make this happen, a new system. So, anyway, this is again summaries of what they are. There's 1 primary care clinician plan. There's 3 primary care ACOs, and then there's like 20-something, let's see, accountable care partnership plans. There's 13 ACO partnership plans and 2 MCOs. So altogether, you have nearly 20 options, I guess, but 13, 15, 18, 19 options. So 20, I was exaggerating. But those are the number of options you have, with PCC being statewide, obviously. So within PCC, there's, so the first thing, if you're changing your personal care practitioner, you would have probably the best way to do that would be through the PCC program, but hopefully, you follow your primary care practitioner and it makes sense. And to figure out if it makes sense, you have to compare the health plan options. And there's more than one in an area, okay, and this shares, this is sort of walks you through each health care plan. I don't want to spend too much time on this, but see how then on the right they tell you about special things like dental kits, mobile ID card, free car seats and booster seats. There's certain things that they're targeting for prevention purposes and trying to recruit families, so they have certain give-me's, bike helmets for kids. So there's value to some of these South Coast Alliance. And then to check, these programs include the hospitals. So you may want to basically then see what hospitals, are tied into these different plans. So BMC is probably going to have the local hospitals and Boston Medical Center. That's my gut on that. And the way to check would be then, call customer health or just check, oh, here you go, accountable care partnership plans. This tells you the hospitals for those regions. I still would call. I think I still would double check on that. But in the case of BMC, they're both a managed care organization and a accountable care partnership plan. This applies to the hospital system they have. Okay. And then here's some more. And then you got Berkshire Fallon, okay, which is in Adams and Pittsfield service areas. And by the way, that doesn't mean it's just for Adams and Pittsfield. Let me take you to page 36, okay? And I'm taking you there. And see how, if you go to page 36, look up Adams for the heck of it, right? Is in Adams. But let's look up a town really. Here's Blandford. Well, they're in the Westfield. Berkshire is in the Pittsfield area. Let me find you another one. I'm looking for Berkshire. Not Berkshire, Pittsfield again, or Adams, just to give you an example of how, obviously Charlestown would be in the Boston service area. But just the bottom line is you can find your town, and if you can't, I'm sure you can, contact the Masshealth. And then here you see Montague's, Greenfield. Montague is a town I never heard of till I visited the arc up there many years ago. So let me go backwards now and just take you through. Basically, you can change health plans during the change plan period, except in the case of the primary care clinician, which you can change at any time. And then here are the following situations where you'll be able to change any reason. And that's children who are in the care and custody of DCF, youth who are in the care and custody of DYS, newborn and children who are younger than 1, which obviously makes sense because they weren't born when you joined the plan. And then members enrolled in the primary care clinician plan. That's the only general category. And then if we talk about, let's go to page 32. There it is. Sorry, I'm overshooting. These are the exceptions to fixed enrollment periods. There's not a ton of them. I mean, it feels like a ton, but you can see they're very specific reasons, right? So in some cases, you can't have related services performed at the same time because of your condition. You're allowed to, address that. And there's appeals and fair hearings, which I didn't put in the PowerPoint. I probably should have. There's a whole process for that. And basically, if you demonstrate that, they're not meeting your accessibility needs, you can also change during the year. So there are, in the case of disabilities, if a place really, you end up with a specialist that really doesn't get it, yeah, you can change it. In terms of fair hearing, let me get you to that, page 35. Here we go. Carrie, I think we'll have to add that to the PowerPoint, or else that'd say page 35. Basically, you can contact Customer Service Center, but again, I think you probably, if you really have serious issues, you're going to want to. Sorry, I'm trying to get this size. Man, I am really not doing good at this. Here we go. Appeals and fair hearings. If you disagree with a decision made by the health plan or plan providers, you can file an appeal or request a Masshealth fair hearing. By the way,
hey, excuse me, Leo. Can you speak a little bit louder? Some people are having difficulty hearing you.
Okay, sorry about that. I think I got caught up in trying to fix the page. Basically, you always have a right to a fair hearing or an appeal. And you may know about that already if you work in the field or if as a family you've gone through a problem. But if you're not happy with a decision made by the health plan or the health plan's providers, you can basically file an appeal or request a Masshealth fair hearing. Now, each health plan will have some initial steps, and you should work through the health plan. And then at some point, this is sort of the fallback is the Masshealth Customer Service Center. And eventually, when the Ombudsman office is set up, I would recommend that be called for sure. So, all right, I'm wondering if people have any questions, Carrie, and if there's something that we didn't cover that they might have questions about.
Yes. So Irene typed in a question back at the beginning of the presentation. And what she is asking is, currently we have issues with providers not bringing clients to the ER when they need to, due to the issues of neglect. Won't this new Masshealth effort to reduce ER visits promote even more neglect?
Well, that's an interesting, interesting question, I have to say, because so what I get feedback from people in the field is that they're often pressured to go to the emergency room because of sort of being extra careful, and that if anything, this should hopefully help with either way, right? Because you should be having people following you. They're trying to reduce the number of visits, and so hopefully they'll be addressing the problem. I think what you might be getting on your question is, if you have an incompetent doctor, right, competent healthcare professional, and if you see signs that the person's incompetent, I think you should change physicians, I think, or if you see someone, I ended up the family member emergency room 3 times in a month-and-a-half period. And they kept, because A, his PCP wouldn't see him, okay, his bottom line, and would refer him, wasn't addressing the full issue, right? It turned out he had leukemia. They weren't finding it. And so these things happen. I do feel that that primary care practitioner was the issue, not us who were trying to solve it, but we didn't accomplish anything taking it to the emergency room, and except for the third time when they finally found that that was the case, right? But imagine, you know, so no, I don't think it's going to reinforce it. I would worry, I guess, to your question, if it's not implemented the way it should be. You know, we obviously would want to hear about it, and you're probably right. Yeah, there is a percentage of people, whether it's in any setting, you know, that don't take that extra step and go to the emergency room when they're not sure what's going on, and they should, you know. And obviously, there's sometimes or urgent care, right, which is even probably better than emergency because they might, you know, might be able to get to the problem quicker. But the bottom line is, I get your point, and it's a possibility. But again, if that becomes endemic, I think that's where we should say, hey, obviously you're saving money, but you're saving it the wrong way.
Okay, thanks, Leo. And then Patricia has a question. Do we know how many Masshealth folks are due to a true disability versus those with low income? Or is there a way to find out that information?
Okay, so there's one, the last I knew was about 1.8 million people in Masshealth, right? We know there's about 600 people with this, 600,000 with disabilities historically, you know. Now, whether they're all in Masshealth or not, I don't know. Could be 300,000 of those folks or disabilities are in Masshealth. Okay, is possible, or maybe a little higher, but that's just to give you a scope. It's less than 600,000 with disabilities. It's let's see, and that might be mainly adults, by the way. And then there was about 1.8 million overall Masshealth. But if you wanted to get statistics, I mean, possibly going online to Blue Cross Blue Shield, they have what's called MMPI. Let me go down. Let me just see how I can get to. That's interesting. Let me go back to share my computer. I'm pretty sure it's MMPI. You're sharing your desktop. Okay, I am. So why can't I? Here we go. Let me go here. I can show you a site where there might be. Here it is, Massachusetts Medicaid Policy Institute. You can Google Medicaid. You know, that's what I'd Google is MMPI Blue Cross. That got me there, and then see if you see statistics and, you know, something like this, November 21st PowerPoint. You could always, and if you don't get anywhere, you can always contact, ask if your state rep could get that information, or state senator, you know. But I think my ballpark numbers, I think the 600,000 is on the high side for adults with disabilities. I think that includes other adults, elderly who may have other insurance programs. But you know, in terms of kids, adding kids to that could be another 50,000 kids. So say 350 to 400,000 ballpark out of 1.8 million. That's an educated guess, but it's not a hard number.
All righty. And then Mary has a question. Will all Masshealth members receive this letter? Talking about probably the green striped letters.
Yeah, I mean, yes. I mean, my expectation is, well, those with another insurance, I don't believe they will. And that's actually, we're trying to get some answers on a couple of more specific items over the next day and a half. So we will post that site we were showing you where you can get the guide. We will have Masshealth Now as a third thing above Department of Developmental Services eligibility here. And it will be, you'll click it, and there'll be, you know, some more information around that. But for basically, I think if you have Medicare, you're not getting a letter. You know, I think if you have Blue Cross and Masshealth, you're probably not getting a letter. I mean, someone could tell me if I'm wrong about that, if they want to raise their hand and text. That would be great.
Okay. Allison has a question. A question I have heard from a lot of families is how are mental health and ABA services being paid for in general with the new plans? I've heard 2 clients whose plans have changed to follow their PCP office and are being told that their ABA services shouldn't be affected. One client has Masshealth Standard and one client currently has Neighborhood Health Plan.
Right. So, okay. Long-term support services are not going to be tied into this for 3 years. So anything, you know, that already exists. Now, behavioral health, what I got to get answered is ABA considered long-term support, or is it going to be just seen through the lens of behavioral health, right? So if it's seen through the lens of behavioral health, I guess we're going to get that question answered, just to double check. But I originally thought it wasn't going to be affected.
Okay, and can you speak to what is happening with Neighborhood Health Plan, specifically which is the regional carrier no longer being offered on the North Shore?
I don't know about that specific carrier. You mean as a Masshealth option? You want to? Is that what you're asking me? I know they're part of Partners now, is it? Am I right about that?
Yeah, she says yes. They are. She said yes.
So they made a decision. You know, I'm assuming what's happened is Partners, since they were purchased, there was 2 plans. One of them, I'm trying to remember if Neighborhood Health was purchased by Mass General. Bottom line is, if Partners has an ACO, right, in this program. Let me pull open. Let's hit Control F and hit Partner. Yeah, that's not the one I want, though. Yeah, there we go. Oh, great. Okay. Yeah, it's too many. I'm going to have to look up Partners in the, let me look it up in the, I guess it doesn't have it, huh? It doesn't have a, what's this? Because if Partners is in the North Shore, that might explain that. I don't think Tufts is the one that bought them. I know Tufts bought something else, and let me just Fallon Health. So you can see some by the way, pretty big insurance companies are in on this. Neighborhood Health Plan, okay, hold on. This is probably what you're referencing. So they're up in the Merrimack Valley, looks like, right? They've chosen to just concentrate there as a partnership plan for whatever reason. Now I'm just trying to see. There's the Tufts. So Tufts, I just make sure Tufts isn't. If it was Tufts, we're going to see with Bidco. Oh, interesting. With Lynn, they're covering Lynn and Lowell. Okay, Cambridge Health Alliance, Community Care Cooperative, Partners. Here you go. And Partners is statewide. Wow. So if they are the ones that bought them, that might be what's going on. They just made I don't know what to say. So you'd have to call Neighborhood Health Plan to get more information. But if I'm right about who bought them, if it's not Tufts, you know, then basically that might be the reason why they're covering the whole state.
Okay. Who are the 9 community partners?
Okay, I wasn't going to cover that today, but I can. And that's actually in the first PowerPoint, so let me pull open my slide. But actually, I'm not even going to use that. Here it is. I'm not going to use a slide. I'm going to just open this up. Okay. So basically, these are the community partners 1 through 9 for LTSS. Is that? And if you want to know for behavioral health too, is that we should post these, Carrie, as well on that Medicaid page. I didn't ask Katarina to do that, but we will. This tells you the service areas. But you can't, here's the thing, like that's good for you to know as a provider, so we should just put it up as a family. You can't really refer yourself. You can complain. If you end up in an ACO program and June, the community partners start, and you feel like you could benefit with a fuller evaluation by the community partner for LTSS or behavioral health, you can complain to the ACO and say, hey, I would like this fuller assessment of myself or my brother, son's, daughter's needs, you know? So keep, you know, I would think that would be a thing. And then the other one, I told you, was a bunch more, right? And these are the ones. And we'll post this up too. Okay?
All righty. Any other questions? I'll give you a couple minutes to chat in any other further questions that you have. All right, then. So it doesn't look like there's any further questions. I want to thank all of you for participating in today's webinar. We hope it was helpful, and thank Leo for presenting. At the end of the webinar, you're going to be rerouted to a brief 5-question survey monkey, and it's just for you to report about your webinar experience and whether or not it was helpful and any suggestions for future webinars. So I hope you join us again, and take care, everyone. Have a great day.